I'm Barb Hickner at the Family Health Clinic. I am the Outreach and Enrollment Coordinator. For our 25th anniversary, we're interviewing staff and community members to explore what the Family Health Clinic means to them. In this video, we're interviewing Suzan Overholser. And Suzan, why don't you tell us a little bit about yourself and give a little introduction, please?
Sure. Again, as Barb said, I'm Suzan and Director of Operations for the clinics. So my role is pretty varied in the fact that I do, pretty much standard operations things, but I also oversee the finances and the grant reporting and writing and things like that.
Very good. Now, how have you seen the Family Health Clinic grow in the community since you started? And I guess how long ago did you start, first of all?
Yeah, sure. I started with the clinics in June of 2011. So I've been here 9 years. And, being in operations, I think the first thing that came to my mind was the facilities. We have 5 facilities in 4 communities. And every one of those facilities, since I have joined the organization, has either been added to the organization or remodeled. So every single site has been touched in some way that impacts the community. So that's the biggest thing that I can think of is just the buildings and our presence in the communities.
So that's a lot of growth. Yeah.
That's a lot of growth.
What are some ways that you have seen the Family Health Clinic have an impact on the community?
Sure. I think, I referred to the growth and the impact in the community, especially in the towns of Wolcott and Burlington, because we were new to those communities. And both of those communities had, Indiana is no different in our rural communities than across the nation in that, we've lost our family physicians. It's hard to attract new physicians into these rural communities. Our communities are designated as medical shortage areas. That's based upon physicians, a physician count. So in both Wolcott and Burlington, they had lost family physicians and they were without primary care. So the fact that these small communities, and if you look at the demographics, our communities are older and than the state average. Our incomes are lower than state average demographics. So these folks had access problems. So just being able to provide them with local health care that they could get to and they could afford, I mean, that's a win. That's impact.
Yeah. And you've seen it in the 9 years since you have been here.
I have.
So what does being a part of the Family Health Clinic mean to you?
Sure. I think if you would ask my family or those that know me well, they would say that I probably have some workaholic tendencies. And I guess I have to agree with them. Not something I'm overly proud of, but I am proud of the fact that, over 20 years ago, I made the distinction and the decision that this is the way I was, this is the way I'm wired. So if that's me, then I want my work to matter. And the work that I do for the clinic, I can see the impact that it makes on other people. And so, I see my work as part of my mission in life. And I see it as it's my mission in life to serve others. And that's what we're doing at the clinics. It may not, be an outright, people can say, oh yeah, she's serving, but we need our clinics to run smoothly, and we need them to grow. We need to offer new services, such as behavioral health or when, when something identifies, just like now, we've got, we're fighting a pandemic. And so our clinics have gone through lots of changes and scheduling and modifications, and offering testing, and that just doesn't, you just don't snap your fingers and that happens. It takes some structure and some change management and some organization to make that happen smoothly. And so I may not be providing that healthcare, but I feel that what I'm doing is important.
And I see that you have the vision and mission statement right behind you.
I do.
Camera. So that's pretty cool that you are.
Thank you for making those available, Barb.
You're welcome. You're welcome. Well, Suzan, what is one thing, this is the last question for you, one thing you want the community to know about the Family Health Clinic? And there may be a thing, but that's okay too.
I think that what, I just wish that we could, convey and make our communities understand is, we really do provide high quality access to care. And too often I see misconceptions in our community about who we are and what we do. And then I also see misconceptions within, maybe not misconceptions, but it's the fear factor of healthcare. With healthcare, it's not like going to McDonald's and I'm going to buy a hamburger for X amount of money and X amount for my Coke. I just got off the phone this week with a patient's mother considering services. And, she just needed to say, how much is this going to cost me? Because, I have insurance, but I can't make, but I haven't made my deductibles. And so she was fearful of accessing care. But when I explained, our sliding fee scale, wasn't eligible for that. I explained our prompt pay discount. She's like, oh yeah, we can do this. And that's what I want our community members to know, is not to be fearful about accessing healthcare in their communities. Please call Barb or Antoinette or Lori, our outreach and enrollment coordinators or our patient care coordinators, so that they don't delay services, so they don't, aren't fearful to get that behavioral health. They aren't fearful to get, that their diabetes checked. So I guess that's the thing that I want the community to know is, please don't be embarrassed to ask questions or reach out to say, how much is this going to cost me? Or how long am I going to have to wait? Or what can we do about this? Because our role is to provide access to our communities. And I think our folks are very open and helpful if you just ask.
Wow. Thanks, Suzan, for
You're welcome.
your insight and your time and being involved with the Family Health Clinic. You are truly a gift.
Well, thank you, as are you.